treatment options. Okay, so, and I know you have a medical background, I have a medical background, and you always, you know, there's conservative and then there's surgical things
Right.
a lot of times that can be done. So let's focus on this arm right now. Conservative-wise, is there anything that people can do? Can they stretch? You know, what can they do?
That's an excellent question. A common thing for people to do instinctively if they find out about the disease and they know that it's going to be pulling their fingers down is to stretch the fingers
Is that right?
back.
Okay.
But that's probably the wrong thing to do.
Really?
Because this process seems to be triggered by mechanical forces in the palm. So people who do heavy work with their hands are more likely to have it show up earlier in their life. And if you look at the biology in the laboratory, how the cells actually behave,
Right.
they're definitely provoked by traction forces. And so the business of trying to stretch fingers back may actually be triggering the same kind of process that started it going in the first place.
So it's more of a mechanical stress, that is.
It's a combination of mechanical stress and a genetic predisposition.
Gotcha.
And
Okay.
so, but it's not always clear that way. And
Right.
so many people who have sedentary jobs and don't do anything terribly stressful with their hands also develop this. It's not just a response to mechanical problems.
I understand.
And so what else can people do? Well, knowing that mechanical forces are involved, if people are doing things that are hand intensive, weight training, tennis, golf, you can do things that will take some of the stress off of the palm, and that would be if you're holding something that is a handle or a cylindrical grip, you can increase the diameter by wearing gloves or having a pad around
That's true.
the handle, because that reduces the amount of stress on the tissues when you grip it. So upsizing your tennis grips, your golf grips, wearing gloves when you work out with weights, or considering doing a
Right.
different type of workout than a workout that involves grip. Those are things mechanically that can be done. The underlying biology has some similarities to the biology of cardiovascular disease. And so things in theory that are heart healthy ought to be Dupuytren healthy as well.
Is that right?
People that smoke are at greater risk for getting Dupuytren disease as well. It may just trigger it earlier in their lives. And so leading a healthy lifestyle, not beating up your hands too much are really the things to do at this point.
It's interesting too, because I'm listening to what you're saying about the gloves when you do weight training or you're playing tennis or golf even, right?
Right.
And for me, and I'll be the first to admit, you know, the first thing that stops me from doing an activity that's not good for my body is pain.
Right.
Okay, and from what you have said and you have educated me is there's not always pain with this condition.
Right.
Can you comment on that?
Well, you're absolutely right. And so what triggers people to go to the doctor? They go to the doctor if they're worried that they have a serious health condition. They go to the doctor if they have a painful problem. And they go to the doctor if they have something which is really interfering with their life. And so with early Dupuytren disease, often none of those things really apply. People think they have a callus or they think they have arthritis. They have a little bit of a bend. They don't have any major functional problem with it. And it doesn't hurt, and so they just blow it off. And
Yes. And that's not always, well, we know that. Putting things off is not a good thing to do, that's
No.
for sure. So, all right, the conservative end, let's talk about surgery, okay? Because I have seen pictures of people who have had multiple surgeries for this
Right.
condition. Can you comment on when and if surgery is warranted and how successful is it?
Right. Surgery has been the standard treatment since this condition was formally described in the 1830s.
Okay.
And what's offered for it are different types of operations with the goal of just trying to get the fingers able to straighten out further. Right now, there are two main approaches. One is the standard surgery, which is the most commonly done, which is to go to the operating room, open up the hand, and remove the tissue that's abnormal under the skin. It's kind of like taking out scar tissue.
Yes.
It's technically challenging. It should really only be done by a hand surgery specialist. And that type of surgery works well for most. Most people do very well after that kind of surgery, but there is a risk of having complications with nerve injuries and with having a kind of a long recovery afterward.
Right.
Most hand surgery that's similar in scope, the recovery is in the range of 6 to 8 weeks, something like that, before people are back to doing normal activities. And for many people after Dupuytren surgery, that's the case. But some people will take months and months to recover, and the surgery itself will provoke swelling and pain and stiffness in the hand that can take months to recover from, even close to a year.
Right.
So that's the risk of having surgery. There's also minimally invasive procedures of cutting the tissue under the skin, which is kind of like a string under the skin. So if you can cut that string, you may be able to pull the finger out straight. And that can be done with a very small knife, or even using a needle with the tip of a needle has a little knife edge on it. Or there's an injection of an enzyme which can dissolve the tissue to a certain extent or weaken it, so that you get the shot and then you come back after it's had some time to work, pull on the finger and stretch that out. And that works well. The difference between the traditional surgery and these minimally invasive procedures is that the traditional surgery has a longer recovery and a higher complication rate, but on the average it lasts longer before it comes back,
Oh, I
because
see.
no procedure cures it.
Yes.
Now, some people will have a procedure and it'll be good for 20 years, and some people it'll be back in a year or so. So the traditional surgery is more to go through, but it tends to last longer. The minimally invasive procedures have a quick recovery and a low complication rate compared to surgery, but they last on the average only about half as long as the traditional surgery. And the timing of it, you'd all asked
Yes.
about. The procedures for this are only for bent fingers that you want to straighten out.
Okay.
There's not a preventative treatment for it.
Right.
So, sorry.
That's okay. That's okay. You know, two things that are popping to mind. You know, when you're talking about surgery, one is recurrence.
Right.
And this seems like a condition where there is a likelihood that it may reoccur,
Right.
depending on what type of procedure. And then the other thing, I have a question for you, maybe you can comment on this, is scar tissue. For example, when I do surgery on the bottom of the foot, I have to really evaluate that, how the scar is going to be, because that's a permanent mass
Right.
on the bottom of the foot. What does scar tissue do after a surgery?
Well, most people heal well afterward, but the problem with Dupuytren disease is that it is in some ways a problem with the biology of scarring itself.
Okay.
The primary disease, when you go in and operate on someone who has this, who's never had surgery before, when you open up and look at the changes that have taken place,
Right.
they are scar tissue. If you send it off to the lab will say, yes, this looks like scar tissue. It's not, there's not a definitive difference that the pathologist would say, oh yes, this is Dupuytren tissue. They'd say it's
Yeah.
consistent with it, but if you said this is just scar tissue, they'd say, yeah, this looks like scar tissue. So the problem with that is that normally when you do surgery on the feet, when you do surgery on the hand, you know what the different layers look like. There's skin, and then under the skin there's this nice yellow fat, and then there are different layers that you can identify by their texture and their color. But the Dupuytren process changes everything in its wake into this tough gristle scar tissue, and it wraps around the nerves and the blood vessels, and so you can't really get your bearings, and you can't see the normal landmarks that you'd like to see doing surgery in an area like this.
Right.
And when you have operated before and it recurs and you go back to operate again, that's even worse. It's even harder to tell where things are, and your risk of cutting something you don't want to cut inadvertently goes up.
Right. No,
So-
that makes sense.
Yeah.
That makes sense.